use. Experiences, perspective, thought processes that you want them to use. So how did we do it at Minute Clinic? Well, the first thing was the clarity of purpose. We made sure everybody understood it. But beyond that, we had a marketing tool that in every market, we expected our employees to go out to community organizations, Better Business Bureaus, Lions Clubs, schools, and talk about Minute Clinic. Present, educate people on what it was about. And part of it was, why are we doing this? And I will tell you, the best way for someone to learn is to teach. So by having our employees required to go out and talk to people and talk about Minute Clinic and share with people what was going on, helped us create a very, very consistent vision. The second piece, the mechanism of creativity, we had whiteboards in every office in Minute Clinic headquarters. And the idea was that you would take whatever problem you were working on and you'd write it on the board. So you'd write your top 2 or 3 problems, and then as people worked in and out of offices, you would see people kind of saying, I was thinking about this, and suddenly you'd have a session at the whiteboard. We also put them in the hallways within a function. So in the IT area, we would list the performance of the function and the key problems that needed to be worked on. And as people walked by, they could write comments, they could write questions. And it prompted creativity. The web of communication was the next one. We created, for one example, we created what I called Talk to Michael. And it's a very simple solution. It was an email box that went through the server, and all of the routing information was removed. So that by the time it came to me, it was completely anonymous. Now, I will tell you that my staff hated it, because I had a finger on what was going on out there. Now, granted, there were some crazy ideas. I mean, I had some crazy messages coming to me telling me that we needed to eliminate perfume in the office because the person in the cube next to us wearing too strong. Yes, we got some nutty stuff. But what was great was it created a barometer. I knew when things were happening. I could get a sense, because you could read. I would get about 100 emails a week, and I would read through them all religiously. I read through them early in the morning before the office opened up and a little bit at night, and the thematics were always excellent. You always knew what was going on. So when we had a problem with IT being too slow, I knew about it before IT knew about it, because people in the field were complaining to talk to Michael. So you've got to create a web of communication. The last one was to understand people's gifts. I did an orientation and I asked one question: why do you get a paycheck? And you get great answers. Well, because I provide services and you got to pay me. Because I have to pay my bills. Because I've got a family to support. Okay, I get it. But I was looking for one answer. You get a paycheck to exercise your judgment. And I think this is a critical part of what we did in the culture. We made it very clear to people, look, you come in with different set of experiences, a different education, different successes, failures, gifts. You come in with a completely unique perspective. I expect you to raise your hand. How many of you sit in meetings listening to someone rail on about the solution and the newest innovation, and you don't say a word, but the minute you go to the restroom, you say, can you believe they're going to do that? That's ridiculous. And I said, we're not doing that. You raise your hand. If you think it's ridiculous, raise your hand. Now, let me tell you, you're going to be wrong. Be ready. You're not going to be right every time. But you have to be willing to raise your hand. All right, the external influences and how we dealt with them. Well, the first thing was clearly the barriers that came up were state regulations. And this is one of the things where I think healthcare has to be reformed. The fact of the matter is that we have different healthcare rules and regulations by state is lunacy to me. You're going to tell me that medicine, good medicine in North Carolina is very different than good medicine in Colorado? I mean, think about this for a minute. If we did our driving the same way, think if you were going to try to drive across the country under the medical system, you'd leave California, You'd drive to the border of Nevada, you'd stop, get out, take a driver's test, get approved to drive in Nevada, drive to the next state, get out, take a test. It's lunacy. And we have this patchwork quilt of regulations that if it's good medicine, it's good medicine. And it applies to all of us, or it should. The second piece was organized medicine. Their fear was really all about the quality. The fact of the matter is that there is a guild mentality within healthcare that we have to undo. And wonderful people inside the healthcare system understand this and are trying to do it. But it's an important piece where there's not the willingness to look outside the system for solutions. If you want to change behavior, where's the best function to go? Marketing. Who is better at changing behavior? Why not start thinking about healthcare compliance from a marketing perspective? How do you market to somebody? How do you make healthcare quality cool? We've done it with coffee. We've done it with technology. We need to do it with healthcare. The payers were also concerned because they said, you know what, if you make healthcare accessible, people will use it too much and we'll be paying too much. So what did we do about it? Well, from an internal perspective, inside the system, what we wanted to do was we wanted to start out and build it by using organized medicine's standard of care. So all of the decision algorithms we talked about were established based on the Academy's published best practice guidelines. We then said, okay, now I want your input. So we invited members of the American Academy of Family Physicians, pediatrics, NPs, PAs, everybody that was voicing concerns about us, we said, come teach us. So we created an advisory board so that we would come in and we help them help us make MinuteClinic more successful. The final piece was that I wanted a seal of approval. I wanted something to be able to hold up to say, I've met the best standards in healthcare. And right now, the best one out there is the Joint Commission for Healthcare Accreditation. We were the first retail clinic, and the only retail clinic, to go through the entire process, and it is a laborious process to validate that not only the care delivery, but the administration, the management, the leadership met the highest standards in healthcare. Well, that wasn't enough. So what we had to do was we had to prove that the outcomes were there. So in 2005 to 2006, we pulled 57,000 cases of acute pharyngitis randomly from our records. And we studied them for outcome measures according to the best practice from organized medicine. Before I show you the results, I want to give you a couple of data points. One is the New England Journal of Medicine published an article that said that pediatrics in the US, that about 47% of the time, a child got best practice care. Only 47% of the time. Rand did a study and said that as an adult, your chances are only about 1 in 2 of getting best practice care. Now, with the structure that we built at MinuteClinic, our delivery on best practice care was 99.15%, over 57,000 cases. So we were able to prove that, yes, the quality was there. Now, the payers, this access problem, they're concerned about it. Well, we went to Rand and said, you know, we'd like you to come in and look at us. They did, and basically they looked at us relative to emergency rooms and physicians, urgent care, and what they found was that we cost substantially less. 30% less than urgent care, 35% less than physicians, and 80% less than emergency departments. And it also said there was no increase in prescription usage. You know, one of the concerns was that we'd be a prescription. We sold it to CVS. We were in a CVS. We were concerned that would be the problem. And the fact of the matter is, retail clinics are a quality innovation in healthcare. So, based on that, based on the process we went through, what could you do within your own organizations? Well, the first is think about your purpose. What is it that you're doing? What do you want to do differently? Why are you doing it? How can you do it differently? Think about where you can make the biggest improvement. And then think about acceptability. Who are you serving? Not just externally, but internally. Who are you serving? What do they want? What do they expect from it? What alternatives do they have? What will be their metrics for success? The third piece is really about culture. And culture is a funny thing. Culture isn't a corner office kind of dominant delivery. Every one of you can create a culture within your own or portion of the organization. So the question that I'd like you to go back with is, what can you do to encourage people to innovate? How do you help them understand their gifts? How do you facilitate this innovation? How do you best engage the staff that serves the customer, internal or external, within your organization? And of course, the final one is the external influencers. Outside of your group, outside of your organization, what are the regulations out there? What are the political moves that you'll need to make? Who do you need to solicit support from? Well, I hope I've at least made you think a little. I made you laugh a couple of times at least. So at this point, let me back up and give you a chance to ask me any questions. Questions about Minute Clinic or about the innovation process. Oh, this is an easy group, good. Questions, you never know what you're going to get, so. Yes? I can't take credit for the initial. The question is, what was the spark that really started this whole piece? What prompted me to create it? I need to make a confession. I did not create the business plan of Minute Clinic. It was actually founded by 3 people, a physician and 2 entrepreneurs. And it was based on a very bad experience in an urgent care where the entrepreneur was sitting in the urgent care for the 3rd time that month, waiting for his child to be taken care of because of an ear infection. And he simply said, you know what, there's got to be a better way to do it. And so he teamed with a physician, and that's where the concept came from. I really came in with the systemic understanding of how to expand a concept and define it. So my role was to take it from 19 clinics to 500. That's really the process. And improve the execution of it through the system. Any other questions? We've got time for one more if you want it. Yes?
What are some of the state-to-state challenges that you were talking about? And are there any states or is there any regulation or anything that helps?
She asked the question, what were some of the state regulations that I found as barriers, and what do we need to tear down? Well, there are a number of them in that depending on who can own a practice, for example, in many states, 38 of the 50 states, there is a corporate practice of medicine law that says non-healthcare providers cannot own a healthcare organization. So as a result, we had to create a management company. We had to do work around it. But let me give you, I think, a story that will illustrate the point a little bit better. And that is, I was meeting with the CEO of a major medical system in the Midwest. I won't tell you who it was, but major medical system. And I'm talking to him about the generational differences and the millennials' expectation of using technology. And he said, Michael, you're absolutely right. He said, you know what, just the other day, he said, I get a text from my son who's out in California, and he's taken a picture of his thumb. That he's damaged his thumb. He's hurt his thumb. And he takes a picture of it and sends it to his father, who's a physician, CEO, says, Dad, should I be worried about this? Well, as a good physician, you don't treat your own kid, so he went down the hall to a colleague, said, here, what do you think? The colleague looked at the picture, called up the son, said, yeah, it really does look like you need an antibiotic. What's the nearest pharmacy? I'll prescribe an antibiotic, and he did. An hour after the kid sent the picture, he had treatment for his thumb. Now, that sounds wonderful. It's illegal. So, I appreciate your attention. Thank you. I want to keep us on schedule. Thank you very much.